interview to get to. Want to welcome
Yes.
Dr. Badia to the program. Good night, sir. How are you? Welcome to Inner Stance.
Thank you. How are you tonight?
We're great,
Very
man.
good, man.
All right. Well, the reason I wanted to talk to you because I've been getting a lot of releases, from your company in relation to injuries, athletic injuries, and how to solve that, whether it's through surgery, etc. And I want, before we get into the real questions in relation to what you do, explain to us exactly what your company is and what exactly you do and how you help athletes.
Well, my center is called the Badia Hand to Shoulder Center. It's a center devoted to upper limb surgery, and a lot of the focus is on sports injuries. So we're talking hand, wrist, elbow, and shoulder. And it's a kind of one-stop shopping place where a lot of patients come from abroad, and in one place they can have an examination, the X-ray, an MRI, the ultrasound, even surgery, and even the rehabilitation. So it's a pretty unique setup, but you don't have to go to the hospital, which is what a lot of the Jamaicans do. Is when they have a complex problem, they'll go to a hospital in Miami, and they kind of get lost in the shuffle.
Where exactly is your facility located?
It's in Doral. It's right near Miami International Airport. It's pretty easy. The website's drbadia.com. And the surgery center is surgerycenter@doral.com. So it's basically a self-contained facility.
And in terms of athletic injuries, you perform surgeries, etc., to help athletes get back to where they used to be in terms of playing professional sports. As you look at your work, how do you describe your work in this business so far?
Well, I would describe it as a minimally invasive approach to trying to resolve these sports injuries. Typically, when an athlete has a problem, they'll go to say the famous orthopedist or the team doctor, but those doctors are usually more expert in knee injuries or ankle, or they're not typically upper limb. They might do a lot of shoulder, but they certainly don't do hand, wrist, or elbow. And that's the niche that we fill. So I would describe it as a facility where you can come with a complaint and really leave with the problem hopefully resolved and getting back to sport or to work or to whatever you like to do.
Of course, you're talking about hand, etc. I presume that you'll work with a lot of baseball players and also probably in Jamaica cricket players who will probably get
a lot of cricketers. Yeah, a lot of cricketers from the Caribbean. A lot from Barbados and Trinidad in particular.
Okay, and what exactly have you helped them with specifically?
Well, because I do shoulder, a lot of the bowlers have problems with the labrum, which is a structure deep in the shoulder, which can tear. It can be acute, meaning sudden, or it can be kind of over time, kind of wear and tear. They get rotator cuff problems. But then a lot of the cricketers have hand problems because they're catching the ball with their bare hands, so they have a lot of digit injuries. And these things are often not given a lot of attention. In the U.S., we use the term jammed finger, which doesn't really mean anything. But this can really hamper the player's career.
Mm-hmm.
Yeah.
What are some of the reasons that you would say would cause some of these injuries? What would you say would cause some of these injuries that you would have seen?
What causes them? Well, when you try to catch a ball going 80 miles an hour, that might cause it. It can be acute, sudden trauma, but again, it can be sort of an overuse syndrome.
But wouldn't it? One of the reasons for exercising is the preparedness for this kind of competitive sport.
Sure. Obviously, it's important to warm up, to stretch, and that can minimize injury. But the truth is, when you're playing demanding sports, there's bound to be injury in some people. And the important thing is to get the assessment early on before it becomes more severe. That's the mistake people make, is that they confide in kind of their family physician who has the best intentions, but is going to miss a subtle injury. kind of like coming to me and asking me about your eyes. I don't really have I don't really have a lot of understanding on a profound level.
Yeah.
So it makes a big difference for the athlete. I mean, I think it's important for everybody, but certainly the athlete has a much higher demand level. So it's important to get an assessment early on. I mean, this is so important that about 5 years ago, a society was started in Europe called iSport. It's the International Society for Sport Traumatology of the Hand. So it's a society devoted to educating athletes, coaches, trainers, and even the public about these athletic upper limb injuries. I was actually president about 2-3 years ago. I was the president, and my goal was really to bring awareness to this. So doing an interview like this was really part of my job. The current president in Japan happens to be an expert on wrist injuries in tennis players.
Oh.
So it is a new sort of subspecialty.
Okay.
So doc, you're saying an athlete can't, we have a lot of our cricketers who have a lot of, shoulder injuries from time to time. There's nothing that can prevent that as a performing athlete at all.
Well, I don't want to say that. We're doing something called ARP wave that in some people it's hard to predict who's going to benefit. But ARP it stands for Accelerated Recovery Program. To give you an example, you take a golfer who's been having a little bit of shoulder pain, and you put this on them, and they go on the driving range, and they immediately gain 20 to 30 yards on their drive. And we're not exactly sure why. I'm having a colleague of mine from Sweden look into this. She's an expert on nerve reflex arcs, but it does something to upregulate the nervous system and allow the joint to do this. So this is something, for example, that Tiger Woods uses. It's ARP technology. It's ARP. So that's something I'm not going to say it's preventive, but a lot of athletes are using this on a regular basis, and it really wasn't available to the public until recently.
Okay. Dr. Badia, can you give us any athletes that you have worked with that you have brought back in terms of doing surgery who had a severe injury, who has been able to come back and be pretty competitive or be even successful?
Well, I always forget the names of the cricketers, so you have to excuse me. In terms of the Caribbean, I had done surgery on a guy named Sean Frazier who swam against Michael Phelps.
Okay.
In the last Olympics. He made the semifinals in the 200-meter freestyle. Being a former swimmer, I appreciated that. I've done surgery on T.O., Terrell Owens. I don't know if you know, in the Caribbean, they follow a lot the American football, so he played for the Dallas Cowboys at the time.
Yeah, I know who he is, yes.
So, there's been a number of famous athletes, but I'm always a little bit careful to mention their names because it's not public knowledge. I don't want to jeopardize the patient-physician relationship.
All right. In terms of your specialty, looking forward, because this is new in relation to you just basically sticking to this. How do you think this will actually, change the game of sport in relation to, sports injuries and helping players?
Well, I think we're talking about bringing awareness to something that people don't even know exists. I mean, people think they go to an orthopedic surgeon and they think that's the end all, but there's too much knowledge nowadays. I can't keep up with foot and ankle. I just don't do that anymore. So if one of your cricketers has a foot and ankle problem, they really should go see somebody who does exclusively that. I mean, the technology and the knowledge base is so deep now that it's really impossible to be a jack of all trades. And particularly for an athlete, they really want to see somebody who deals with that area exclusively.
Yeah. There are a lot of injuries in the World Cup, for example, like the Neymar injury. I know you're looking for, talking specifically about hand, etc. But, what are your thoughts on, his injury? Was it lower back, etc.? Could you help him?
Well, we have a center called Ortho Now. That's an easy thing to look up on the website is orthonowcare.com. So what we have is basically an orthopedic emergency room. It actually serves a lot of the Caribbean. People will fly in, and they can go to this facility, and then they could see the spine specialist. So obviously with an injury like Neymar suffered, you'd want to get an X-ray, the MRI right away, and fortunately he was able to be treated with a brace. But you want to ensure that you're seeing somebody who, if it does need something surgical, that's what they dedicate themselves to. So at our Ortho Now facility, we have all the subspecialties. So some of your listeners may be thinking we only do upper limb, and certainly in my practice I do that. But upstairs, I do. Our group does spine. We do knees. We have one of the best ACL guys anywhere in Florida. So, the important thing is to find the right subspecialist. I think that's the main message. And, unfortunately, a lot of the smaller countries, not just in the Caribbean, but Central America, parts of South America, it's very hard for the medical infrastructure to have somebody who only does hand and wrist, somebody who only does foot and ankle. I think that's going to change, and we want to be involved in that change. We train surgeons from the Caribbean. I haven't had the pleasure of having somebody spend time with me from Jamaica, but I certainly interacted with the doctors there, who are very, very fine doctors. And, we're hoping to be able to help that process.
All right. Sounds good, man. All right. As we look forward, in terms of the World Cup, was there a particular side that you were carrying?
I'm sorry, what was that?
Who are you carrying for the World Cup? FIFA World Cup.
Oh, for the well, I'll tell you, I had wanted Brazil. I'm going to Brazil in 3 weeks, and but they really played poorly, as we all know. So after that, I'm going to Argentina in October. So I was hoping to see Argentina go all the way.
Yeah, definitely. Well, they did. Germany won. So congrats to the Germans. All right. In terms of injuries, there are a lot of injuries out there for different players. We can talk from whether it's netball, football, etc. Are you open to working with more and more Caribbean-based players to help them in whatever injuries that they might have?
Oh, yes, absolutely. Well, I see us as really a referral source. Like I said, we have good relationships with the doctors in Jamaica. I have friends and colleagues on the North Coast. I have a number of colleagues in Kingston. And I visited there last year. But, obviously it's impractical, and I don't have a medical license in Jamaica. But we do have a good relationship with the doctors in case it's something a bit more complicated, or the patient says, I want an opinion in the United States because of the infrastructure. And, we're a friendly face. It's not like going to the university or to Baptist Hospital, which is, kind of a big entity. So we are, not only are we open to doing it, but we do it frequently. I saw a patient last week from Jamaica. I honestly don't recall what the problem was, because about 30% of my practice is patients who fly in. So certainly we are, very open to that. In fact, I mentioned to your listeners, the website is drbadia.com.
Mm-hmm.
That's BADIA. And we want to be, we basically want to be as a resource to help and a less stressful environment than trying to go to one of the big name hospitals and then finding the right doctor. In other words, you want to kind of find the doctor first. Where it's done is not as important. It's really the person that you see.
Mm-hmm. What do you say, to the athletes that you operate on in relation to prevention of injury?
Well, I tell them they need to understand their physiology. I think they need to work closely with the trainers. The trainers have the expertise to try to minimize injury. They have more expertise than I do. I've had patients ask me, how should I tape? And I go, I'm not a taper. I'm an orthopedic surgeon. But your trainer will know how to tape a wrist or an elbow, and the stretching exercises and the conditioning, which is necessary to minimize injury. But I always say minimize, because when you're doing high level sports, contact sports, or things are bound to happen. Fortunately, they're usually not career ending. But the important thing is to seek the right opinion when there is a problem, and hopefully it's a minor problem.
And in terms of cost, let's say we're looking at a referral, somebody from Jamaica, that you need to look on that probably needs surgery later on. Can you disclose those figures in relation to what all of this might cost? Just you looking to see if you can actually help them.
Yeah, the problem with healthcare, it's always complicated with cost because there are several different components. For example, in our center there is the surgery center, which is really separate from my office. So when a patient comes, I basically indicate with my team what needs to be done, and then that generates some codes. Those codes are then given to the operating room, and then they have a separate team of people who do the billing, and they determine that. But to give you a rough idea, I do a lot of carpal tunnel surgery that I do endoscopically. So I don't open the palm. I do it through a little scope, and I can tell you roughly. I have an idea that costs somewhere between $4,000 and $5,000 for everything, for the equipment, the operating room, the anesthesiologist, the surgeon fees. So I can't tell you that it's certainly not a it's not the Walmart of surgery. I mean, this is an elite place, and when people go to the website, they see the quality. It's not. My office looks like it's very, very high end. But we work with people the best we can, and we want to make it affordable. So it's it really depends on what the clinical problem is.
How safe are these surgeries, and in relation to the recovery time for the athlete? I know it might depend on the injury, but can you give us some analysis on that?
Well, like you said, it really depends. But I'll give you an example of like a common surgery I do. I mean, every twice a week I do several rotator cuff repairs or labral repairs, and those patients typically are getting back to sport between 3 and 4 months, which is pretty good. I mean, for a month they're in a sling that we're letting the tissue heal that I repaired, and then they do the rehabilitation. We have relationships with therapists in both Montego Bay and Kingston, and one in the Ocho Rios area. So we have therapists because the patient practically can't stay in Miami, of course, to do the rehabilitation. So we have relationships with therapists, not only in Jamaica, but in multiple countries and in this hemisphere.